Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Maya Rodriguez. Today on the program, all-time highs in new and active cases as the country logs over 34,000 new infections and over 237,000 sick patients. New testing and isolation protocols from the health department as the government deals with limited resources and ballooning cases. How are hospitals dealing with this new surge driven by the Omicron variant? East Avenue Medical Center Chief Dr. Alfonso Nuñez and the Chief Medical Officer and Vice President of the St. Luke's Medical Center, Dr. Benjamin Campomanes, join us live. The country again breaking records in the COVID-19 case tally. 34,021 more people contracted the coronavirus, the biggest single-day increase in new cases so far. Half or 17,000 of these are from Metro Manila. Active cases or people currently sick with COVID-19 also reached another all-time high at 237,387. Aside from new and active cases, the positivity rate is also at its highest in 7 days. Out of nearly 79,000 people tested, 47.9% turned out positive. Meanwhile, there are 82 new fatalities and nearly 4,700 more recoveries. The government is again issuing new guidelines for testing, quarantine, and isolation. Our Caroline Bongkin with the details.
Your vaccination status will now determine the length of your isolation period once you test positive for COVID-19. Based on the Health Department's proposed guidelines, fully vaccinated individuals who have mild or no symptoms will only be required to isolate for 7 days. The count starts on the first day of symptoms. But if asymptomatic, day 1 starts on the testing date. If partially vaccinated or unvaccinated, isolation period remains at 10 days. But those with moderate symptoms will be required to isolate for 10 days, regardless of vaccination status, and 21 days for severe and critical cases. For fully vaccinated close contacts, quarantine is cut to 5 days, but they have to monitor themselves for symptoms, while the quarantine period for unvaccinated or partially vaccinated close contacts remains at 14 days.
Evidence review of our living CPG also shows that the average duration of infectivity and secondary attack are relatively lower for vaccinated than those unvaccinated individuals. Vaccinated individuals had lower chances of spreading the virus within their household and close contacts. Vaccinated asymptomatic and mild cases are unlikely to shed infectious virus 10 days after the diagnosis or symptom onset.
An even shorter quarantine period of only 5 days is required from asymptomatic fully vaccinated health workers exposed to COVID patients, and if needed, may even be cut if the health worker has a booster shot, subject to IATF approval.
This shall also be expanded to other sectors with strict industry standards on infection prevention and control, subject to the IATF approval. For example, we have ongoing discussions with the aviation sector.
For COVID-19 testing, priority are senior citizens, persons with comorbidities, and health workers.
This is because those above 60 years old or with comorbidity can be provided with different medicines or antivirals within the first 5 days of their symptoms.
We prioritize, given the limitations of our testing capacity at the moment, we will prioritize those who will benefit from the testing.
A COVID-19 test is optional for asymptomatic close contacts, but they have to monitor themselves for symptoms. If they need to be tested, this should be done on the 5th day from exposure. Caroline Bongkin, CNN Philippines.
Let's go straight to the source of the story. East Avenue Medical Center Chief Dr. Alfonso Nuñez joins us now. Good morning, Doc Cito. Thanks for joining us.
Good morning, Mai, and good morning also to all your televiewers.
All right, Doc, give us an overall picture of the situation now at the East Avenue Medical Center given this new COVID-19 surge. Because I was just speaking yesterday with Dr. Jonas Del Rosario of the PGH at sabi po niya, matindi rin po yung impact sa kanila doon.
Matindi rin yung impact sa East Avenue Medical Center, and right now, all in all, we have admitted COVID-related patients now 371 as of June 13, 4 p.m. And this includes those patients who are admitted but waiting at the emergency room right now. As far as hospital operations are concerned, we try as much as possible to maintain 100% all of our operations. But unfortunately, because of the healthcare workers that are affected, we had to scale down other operations for the benefit of the COVID-19 response. We have modified yung operating room namin para yung mga elective cases ay hindi muna namin pinaprioritize, and we are prioritizing emergency cases only. Yung mga elective admissions also na non-COVID, hino-hold muna namin pansamantala. Our dialysis center, affected din ang manpower dito. So nag-scale down din ang operations. Our outpatient department, we have already scaled down its operation, downscaled its operation this week from 5-day week to 4 days na lang, and yung operation time operation nila ay cut short into a half-day operation. This is lahat ito para masamantala namin yung mga manpower dito sa mga areas na ito that will be assigned or reassigned to sa mga COVID-19 areas that are requiring full operation.
I understand marami pong adjustments na ginawa dyan sa East Avenue Medical Center to address the surge in cases. You mentioned, Doc, 371 patients, COVID-19 patients right now. How big, did I get the number right, and how big is the jump from the December cases?
Well, just to give you an idea, December 28, we only had one COVID confirmed positive case admitted. And after 5 to 7 days, it went up to 157. That was, if I'm not mistaken, that was January 4 or January 5. And as you have heard it right now we have in our hospital 371 COVID-related patients. These are not only confirmed, these are probable and suspect patients. And this also includes patients waiting at the emergency room who are already actually admitted, but we are strategizing and planning on how to add more beds for them in the regular COVID wards and COVID ICU.
Ang bilis nga nung pagtaas ng mga kaso, Doc Sito, kasi that is reflected also on the positivity rate right now, and we're seeing record highs nga in the past 7 days. Tell us about your dedicated facilities for the COVID patients now. How many beds po ang nandyan at ilan po yung occupied, and what about the ICU beds din po?
Ang instructions ng DOH sa amin is to prepare 50% of our mandated beds, no? And we are mandated to operate at a 600 bed capacity. That means we have to prepare 300 beds for COVID response. And right now we are at 100% for the COVID wards and COVID beds. For our ICU, we have prepared 50 beds for ICU patients. But now we are at 48 beds occupied. That is roughly around 95-96%. And overall, we are more than 100% catering to COVID patients as far as instructions and guidance and preparations by the Department of Health.
Okay, matindi nga pala yung epekto sa inyo kasi nga out of the 50 ICU beds dedicated, 48 na po yung occupied. Can you give us a profile, Doc, of your patients now? Ano po yung mga symptoms nila? Is it moderate, severe, or critical? Are there more seniors or pediatric cases? And more of the unvaccinated po ba? Kasi yun yung nakikita natin na sa mga nagkakasakit ngayon.
During the last week kasi napansin namin yung mga na-admit at nako-confine, mostly unvaccinated. Pero for the past 3 to 4 days, napansin namin halos 50-50 na yung mga vaccinated and unvaccinated. Most of our ICU patients are unvaccinated. From the figures that I am reading right now, it's 60 to 70% ay unvaccinated. And the rest are vaccinated, but with the comorbidities that are affected by their COVID infection. What we are seeing actually is a very high transmission rate. But ang isang napansin namin sa aming mga pasyente, including our healthcare workers, yung symptoms would drastically go down after 48 to 72 hours. This is unlike nung COVID surge namin before, where yung napansin namin, the symptoms would remain for 5 to 7 days. No? So nakikita namin nag-shorten na ito, including sa mga healthcare workers that turned out to be positive sa amin. Shortened na yung kanilang fever, shortened na yung kanilang body pain, body weaknesses. And then they feel better on the 3rd to 4th day, and some of them are willing to go back to work. No?
So in this time around, 2 to 3 days, medyo magaling na sila or wala na silang symptoms, ano, in terms of yung nakikita nila sa kanilang mga kondisyon. I'd like to talk about the healthcare workers po dyan sa East Avenue Medical Center mamaya po. Pero right now po, in terms of the treatment of patients, ano na po ang ginagawa sa COVID cases? Is it the same medical regimen or are there any changes given that may mga additional treatments na po na naaprubahan?
Ini-implement pa rin namin yung standard COVID-19 treatment for all of our patients, especially for the severe and critical cases. We have, as far as equipment utilization is concerned, very critical dito yung high flow nasal cannula machines namin because as experienced before, ito yung isa sa mga very crucial equipment that should be in place sa hospital and should be applied to patients at a very early stage to avoid intubation. And isa napansin namin yung high flow nasal cannula machines namin, the utilization is a little bit lower than what we had experienced at Delta surge. For the high flow nasal machines, we have 53 or 52 units of this, and we are only using around 29 to 32% of them. That means that for this surge, napansin namin, hindi ganon ka oxygen requiring yung mga patients. Maybe because they recover quite early and yung lungs nila ay hindi masyadong affected. For the ventilators as well, nakita namin yung utilization rate is much lower than what we had or we had experienced during the Delta surge. We have 70 ventilators at our hospital and we are only using around 60 to 70%. And this includes yung mga non-COVID patients that require ventilators as well. For the medicines, we have the remdesivir in our hospital. We have the baricitinib in our hospital. These are, at the moment, standard medicines that are being given to COVID-19 patients. We are awaiting the delivery of the molnupiravir tablets and the Paxlovid tablets for use in mild to moderate cases para sa mga outpatient cases namin and also for our healthcare workers that have mild symptoms para hindi na sila aakyat o hindi na sila ma-upgrade to a severe or critical that needs hospitalization.
All right, lots more things to talk about, Doc Cito. I'd like to talk about your medical staff later on, but we have to pause for a break. This is The Source on CNN Philippines. You're watching The Source on CNN Philippines. I'm Maya Rodriguez. Our guest today, East Avenue Medical Center Chief Dr. Alfonso Nuñez. Doc Cito, very quickly, I'd like to ask about your medical staff. Ilan po ang infected dyan, and how do you compare yung ilan yung apektado ngayon doon sa last surge that we had? And paano po na-augment yung resources nyo and healthcare workers ninyo?
As of January 13, 4 p.m., we have 548 healthcare workers that has been isolated or quarantined because they have turned out to be positive. They are close contact or awaiting test results. This is approximately 24% of our workforce. And it might be small, but just the same. Manning a hospital and operating a hospital, manpower is very crucial, especially for COVID-19 response. And admittedly, may mga ibang areas
Alright, mag-ingat po kayo. Good luck po sa inyo at sa inyong medical staff. Thank you so much for your time, Doc Cito. East Avenue Medical Center Chief, Dr. Alfonso Nuñez. Alright, let's check the situation at the St. Luke's Medical Center. Joining us now is the Chief Medical Officer and Vice President of the St. Luke's Medical Center, Dr. Benjamin Campomanes. Doc, thank you so much for joining us this morning.
I thank you, Mai, for inviting us to your show.
All right, Doc, can you give us an overall picture of the COVID situation there at St. Luke's? Kasi po, what we heard from PHAP President Dr. Jose De Grano, he said that 85% of the 20 private hospitals in the NCR have reached critical occupancy level, and that the private hospitals are understaffed with 5 to 10% of its healthcare workers under quarantine. Ano po yung situation dyan?
Well, the situation is not as difficult as the past surges. That's what I want to inform everyone. In fact, I'm looking at just the data now. In BGC, out of 91 beds that we have assigned for COVID, we have only 60 admitted. And interestingly enough, our ICU beds are not full. This is also compared to our Quezon City facility. We, out of 83 beds, we have only 53 admissions there. And for ICU beds, only half full. So these are very good numbers with regards to the number of patients being admitted to the hospital. What is critical, of course, would be the healthcare workers that have been isolated and quarantined because of this surge.
Yes. Oh, well, very good to hear about the numbers. But in terms of your healthcare workers nga po, how many are infected right now or under quarantine? And how do you compare this number to the past surge that we had?
Definitely, we did not have the same number of quarantined and isolated associates and doctors from the last surge. We have now a total of about 700 healthcare workers either quarantined or isolated in both hospitals. But we have been very good in coping with it because we have very good business continuity plans, and we have mitigated this problem by, again, like East Avenue, the non-essential areas have been temporarily closed, but all essential services are still going. We had an issue before with emergency room nurses. We have now taken care of that, and we are in full operation. We can accept any patient that comes to our emergency rooms.
That's good to know, Doc. In terms of your healthcare workers and their symptoms, is it the same as what Doc Cito said, that after 2 to 3 days, they feel better already, wala na pong symptoms? Is it the same with your staff there?
It's the same, and we value very well the new DOH guidelines, which makes us have some leeway with regards to manpower coming back to the hospital soon as possible. They're all most of them are mild symptoms, not like with previous surges.
Well, in terms of the treatment, Doc, for COVID, there are new additional treatments that have been approved, adding to the arsenal that we have to treat severe illnesses and to prevent death. Are there any changes in terms of the medical regimen in your hospital?
Of course, obviously, once we had the monoclonal antibodies coming in, we started with Ronapreve, which was the IV form, and now we have the Molnupiravir, and soon we will be having the Bexovid, which is the generic name for Paxlovid, and they will be coming. That's why we have now new guidelines and order sets for treating our COVID patients. So they really are, at a time where treatment is better, and the course has been lessened because of these new treatment protocols.
Doc, the Octa research and also the DOH is saying that it's still too early to say if we have reached the peak, especially in the NCR. But if this upward trend continues, what are the adjustments to be made there? What is the plan?
Well, we still are, our numbers are not very critical, as I said before. We are only about 50-60% full in the hospital. And what's interesting enough is we do not have much severe and critical patients coming in.
Well, Doc, but what trend are you seeing in terms of the patients who are coming in?
The trend that I see is we've been looking at the severity of illness that we covered from the whole 6 months, August to January, and I'm looking at the statistics now. It's interesting that as we vaccinate more people from a period of only about 20 to 30% to about 70 to 90% now, we've seen a dramatic decrease in severe and critically admitted patients. So it's hard to say when people ask me how many are vaccinated, how many are unvaccinated. I think that those numbers are not the one because they're very small. What we want to see would be the decrease in severity. So from August to January, we've seen from 29% severe and 8% critical to the fully vaccinated with boosters, only 5% severe and almost zero critical patients. And this is versus the unvaccinated people, where we still see about 30% severe and 10% critical. So you can see that I think whether it's vaccination related or the Omicron itself, but I would think that because of the vaccination efforts of everyone, the government and the private sector, we have decreased our severe and critically ill patients being admitted in the hospital.
And good that we're seeing less severe patients being admitted, and we're hoping for better news next time. And stay safe, Doc. Thank you so much for your time this morning. Dr. Benjamin Campomanes, Chief Medical Officer and Vice President of St. Luke's Medical Center. And thank you for joining us here on The Source. I'm Maya Rodriguez. You're watching CNN Philippines.